The hospital stay is an average of 3 weeks. Some people get out sooner and others stay longer. Although we cannot tell you exactly how long your stay will be, we can tell you some criteria needed to be discharged. To be discharged from the hospital, you must have an absolute neutrophil, or white blood cell count, that is rising to a safe level. We will discharge you even if your platelets and red blood cells are not fully recovered, but that might mean you will have to get platelet and blood transfusions after you leave the hospital. You will also need to be eating a small amount of food and drinking fluids. Although discharge is an exciting time, it can also be a scary time for patients and caregivers. There are often many questions about what can be done at home. We offer a discharge class every week to help alleviate your concerns and answer your questions. If you're not from the St. Louis area, it is generally recommended that you stay in town after discharge. The amount of time you need to stay in town varies based on your condition, your treatment, and your physician. We suggest you discuss this with your doctor prior to coming into the hospital. There is a listing of hotels and other local accommodations in your strength binder. When you are discharged, we will make an appointment for you to see the doctor, nurse practitioner, or both from the team you saw prior to admission. Once the transplant team feels you're recovered from your transplant, you will be sent back to your referring physician if your doctor is someone other than the transplant physician. You will come back to see the transplant team on several occasions after your transplant.